Hello everyone, I hope you're having a good time at the award ceremony. Sorry I can't be there with you. I'm currently away with the Great Britain rowing team, which I think is one of the reasons why I was nominated for this award for work outside of general practice. So I thought I'd just give you a couple of minutes of just letting you know what I've been up to over the last few years. So I've been the Great Britain rowing doctor for the under-23s for about 3 years now. It involves looking after the day-to-day health of the athletes, but also the cardiac screening, the musculoskeletal screening, and some of the performance testing at Caversham. It also means that I get to come away to the World Champs each year, so I went to Lithuania in 2012, 2013 I went to Austria, and then obviously 2014 here in Italy. As the doctor for the rowing, I've developed a number of rehab protocols because there are quite a few rowing specific injuries that we see in rowing that aren't really in other sports, and so developing guidelines to help rehabilitate athletes with these very specific injuries has been quite useful to give out to clubs and physios and doctors who don't usually see these kind of injuries. The first one is rib stress fracture, which we see really frequently but isn't very common in other sports. And so I put together a rib stress injury guideline for diagnosis and management, and that's been published on the GB Rowing website. The second one is for chronic exertional compartment syndrome of the forearm, which again is very rowing specific and often requires a forearm fasciotomy. And so I put together a guideline for rehabilitation after you've had the surgery. And we're using that quite a bit. I've had 2 of my athletes this year who've gone for forearm fasciotomies. The third guideline is quite a bit more generic. It's return to sport after tonsillectomy, and I've had 2 athletes this year who've had their tonsils out, and we followed the guideline that I wrote this year. So that's with the rowing, which is actually really good fun. I've also become a accredited anti-doping advisor, which basically means that I go around and speak to athletes about how to not become a victim of inadvertent doping problems, and what kind of supplements they should and shouldn't be using, which is really interesting. I've also done other event cover this year and over the last 2 years, working at the London Marathon and at some of the international triathlon events. Intermittently I've been providing pitchside cover for the Worcester Warriors, which is becoming a formal role as of this season. That's the sort of elite side of sport that I've been doing, but I've also been doing a lot in exercise medicine. And when I came down to Bath onto the VTS, I completed a master's dissertation in physical inactivity, and my project was to develop a new physical activity questionnaire that could be used in the clinical setting to determine whether the patients were adequately active to benefit their health. And I created this new questionnaire and subsequently validated it against the International Physical Activity Questionnaire to make sure that it was accurate. And that's been published at the Royal College of GPs conference in 2012. That's the questionnaire, and we are actually using it in clinical practice at the moment. So, and currently I'm validating that against accelerometry, which is a bit more accurate. I then took that questionnaire a bit further, and as odd as it may sound, I validated it for the pregnant population, because there's no tool for assessing exercise levels in pregnancy. And this came about as another piece of work that I was doing, which was a multi-centred audit looking at how confident clinicians in our area are at giving exercise advice to pregnant women. Lots of women want to be active or become active in pregnancy, and I found out that most clinicians weren't very confident, even in the obs and gynae department, at giving exercise advice. So I gave a number of teaching sessions and then re-audited to see whether the confidence had gone up, which it had, which was quite reassuring, and published the results at the British Association of Sport and Exercise Medicine conference in 2012. I also developed a patient information leaflet, which has been adopted by the Great Westerners Trust, and is going in maternity packs, which just gives advice on to women as to how they can become active or remain active while they're pregnant. So that's more sort of on the exercise side of things. And I also won a couple of bursaries from 7 faculty to go and present this work at the Royal College of GPs conference. As a result of the work that I was doing through my masters, I've been guest lecturing at the University of Nottingham on the Sport and Exercise Medicine Masters course there, which has been a really good experience. And I've also passed my Faculty of Sports Medicine exams, which was a bit more of a tick box exercise, but it was also really a really valuable thing to have done. So I've thoroughly enjoyed running some sports medicine stuff alongside GP training, and it's definitely possible for all of those who are interested in that sort of thing. And that's a quick rundown on what I've been up to. So I hope you're having a great time, and sorry I can't be there. Clearly this is a very weak second best, but I hope you're all having fun, and I'll see you all soon.
Okay, bye-bye.